As the future of the THC industry remains uncertain, Governor Greg Abbott still hasn't indicated whether or not he would veto legislation that would ban the sale of hemp-derived products in Texas. The future of a new industry had its future guaranteed by state legislatures. On Wednesday, Governor Abbott signed Senate Bill 2308, which would allow clinical research on the medical efficacy of ibogaine, a psychedelic drug. The bill would also set $50 million aside for this endeavor.
So to tell us more about this new legislation, we welcome Stephen Simpson. He's the mental health reporter for the Texas Tribune. Stephen, good morning. Welcome to Hello Houston.
Thank you for having me.
All right. Well, let's get to it.
Yeah, so when we speak about psychedelics, what exactly are we talking about?
So ibogaine is pretty much a shrub in West Africa that has been around for centuries. A lot of shamans used to take it to kind of get that spiritual awakening feeling. It kind of found a new life in the Western world in the 1960s when a heroin addict took it trying to find a new high. And what happened is he woke up the next day with no symptoms of withdrawal or even the feeling the need to take another drug again. And so it's kind of become an urban legend in the medical community. A lot of people go to Mexico to kind of take this drug for clinics to kind of get rid of withdrawal symptoms, to get rid of PTSD and even more. It sometimes even regenerates brain tissue.
So let me be clear. This is a drug kind of like LSD in terms of an hallucinogenic, but you take it and it's a one and done. So it's not an addictive drug that would get people hooked on drugs. It's more curative than addictive.
That's right. That's right. People say that once you take this drug, you have no urge to take it again.
Do you have
It's
an
not pleasant.
Do you have an urge to take any other drugs? Like, well, I love that feeling, so let's go find some LSD and try to mimic it.
Yeah. Once you take this drug, it all like the thought of drugs actually causes you pain, is what people kind of describe it as.
Really?
And so once you do that, you almost physically can't do drugs again.
I hear that it also causes some paralysis, like the next temporary paralysis that isn't very pleasant.
Yes. And so what happens is when you take it, you can't really move your body, but you're functioning. You still have all your thoughts and you can still have conversations with people. What happens when you close your eyes is when this spiritual journey kind of begins. And that's when like sort of the psychedelic feeling starts to kick in.
So why are we questioning then THC and hemp, but allowing ibogaine essentially? And you said it was a shrub, so it's natural. So can it technically be called a drug?
Well, it's been called a drug by the American government. So it's a Schedule I drug. LSD pretty much is the same level as that. What it is a natural shrub, but if you take too much of it, it can cause cardiac arrest. It's not a drug you just want to be taking without medical supervision.
Yeah, well,
so it is dangerous.
Yeah, marijuana is a weed, literally.
Right.
So this ibogaine psychedelic drug seems to have benefits enough for Governor Abbott to sign this bill and let us research it at our expense. Why does Texas want to be involved in the ibogaine game?
Well, from what I've heard is former Governor Rick Perry has been one huge supporter of this. Mm-hmm. And another is that we want to have control of the market. They're afraid that if pharmaceutical companies have control over this, that they're going to raise the prices and it won't be accessible to many. So by having Texas be the one that's kind of distributing this and being the one that's kind of creating all this, it guarantees Texans have access.
And what's our stake in it?
20%.
20%. So yes, if it's $1 billion industry, we are in it for $200 million.
Yes, and so it is revenue-wise beneficial for us. And even some of the revenue that we take in, they've already promised to some veteran organizations that they haven't named yet. But any revenue that comes into the state will go to some part of the veteran.
And so you're mentioning veterans, and that was essentially my next thought. And my question was, who exactly would be the typical person or type of patient that would receive this kind of treatment?
So it's been mostly focused on veterans because they have some of the most severe brain injuries. They have the PTSD. They have some of the problems that come with addiction from taking some of the pain pills and things like that. But this would be open up to everyone if it gets, approved by the FDA. But the main people that this would be focused on would probably be people with PTSD symptoms and people with severe addiction.
So, okay, I want to follow that. We're talking with Stephen Simpson, the mental health reporter for the Texas Tribune. If you'd like to join the conversation, we're right here at 713-440-8870. So, Stephen, you said PTSD and addictions. I mean, it's not going to fix your brain, right? I mean, it's not a brain trauma cure. I guess what it does is the PTSD and perhaps addictions from other medicines because of that. This is like a rehab, like an instant rehab. One dose and you no longer have this problem.
So pretty much what it is the withdrawal symptoms once you quit drugs can last up to 2 years. And what this does is cut that process down to 48 hours. I'm still not really sure how it's done. They're still kind of studying it, but it looks like it attaches to the brain receptors, almost like reverses damage done by drugs, and it kind of removes that addiction that is stuck to the brainstem.
Are any of these research groups that you were talking about, are any of those in Houston? Do we know yet where they would be?
We are not sure yet. They're still making the consortium. It'll be a kind of a project between public, private, and some pharmaceutical companies. So we don't have the exact details on who's going to be involved yet, but it will involve some universities.
Have you heard any firsthand accounts from somebody who's actually taken this drug?
Yes, yeah, actually, I had a former Army Ranger come out and tell me sort of his own experience with it. He had been very suicidal. He had been addicted to fentanyl, a bunch of opioids. He was ready to die. And then he heard the Joe Rogan podcast and heard someone talking about the ibogaine. And so he decided to book himself a clinic down in Mexico. And once he took it, he told a story about how he saw multiple doors open up in front of him, and each of them was moments in his life. And each point of those moments showed why he was addicted to drugs. And once he got through that, he threw up and then never felt the need for drugs again.
Now, what if somebody says this could be somewhat like a Band-Aid or like a placebo? That's a placebo effect. What type of research is going into ibogaine and this type of therapy?
So Stanford University is the one that kicked off this kind of massive study into this. And they're pretty much watching veterans when they go to Mexico and when they come back, and they're doing brain scans on them. And so these brain scans are kind of informing people if this is a placebo effect or if this is a medical breakthrough. And so far, it's starting to look like it might be closer to a medical breakthrough.
So what's our take as the state of Texas? We're going to put how much money into this, and then what? We just give it to Stanford, or who do we give it to?
So we're going to pretty much invest $50 million into this project. And so any pharmaceutical companies that want to get in on this have to match it. And so once they come in to match that details, that is when the project starts. The main goal of this will be trying to get FDA approval. They're going to hopefully, I've talked to some of the ibogaine people. They said they've reached out to the Trump administration and are hoping to kind of accelerate that process.
So is this the kind of thing? Is this the kind of thing that Robert F. Kennedy would approve? Do you think?
There's been a lot of mention of Robert F. Kennedy in these. They said that he seemed to be a very big supporter of psychedelics. And so one of the key pieces of this is one of the big psychedelic measures, MDMA, did not get FDA approval. That set back psychedelic research about 20 years. So ibogaine is kind of like stepping into that gap.
Wow. Have any other states done this before, and what did that look like?
Well, this originally tried to get off the ground in Kentucky. What ended up happening is the governor there that was kind of the big supporter of this, lost the election. And so a new governor came in, and they viewed this as not worth the money. They viewed it as a legal drug. Why are we bothering with this? And so they just decided to cancel it out. So Texas will be the first one to kind of take this whole ibogaine front on.
Well, I wouldn't think this would be a party divisive idea. But what you're saying, because that Kentucky went from a Republican to a Democratic, I guess Andy Beshear was elected, went to a Democratic governor who nixed the idea. But I mean, why is this divided on party lines, this idea of ibogaine?
It doesn't seem like it, but there is the potential for it. I know there's a lot of questions of like, why ibogaine, but hemp is getting banned.
Right,
And it seems
right.
to be like the one question that everyone seems to like, doesn't seem to like agree with. And that might be the one thing that like holds back ibogaine, is just like the reaction from other people being like, if you're going to take a drug away, but we're putting $50 million into a psychedelic that's not even proven anything yet. It just doesn't make sense.
And now we're talking about psychedelics as if they're just going to be out there and people can go and buy it at a vape shop. But really, how will it be distributed and how long is it going to actually take till it hits to be in its process of where a patient could be actually receiving this?
So we are probably about, honestly, 6 years away from seeing this hit the market unless the FDA accelerates this. We still got to go through the clinical trial process. And the most important thing is this will probably never be fully available to people just to like go to a gas station or anything like that. Like I said,
But
this is a very medical needed drug. You have to have someone monitoring your heart rate the entire time because this drug can cause a heart arrhythmia and sudden death. So this is something that you have to make a medical choice.
but it's on the market in Mexico as we speak right now. So it's
Yes.
out there,
Yeah, so
right?
Mexico, you can go right now and book an appointment. There's a links you can just go in there and say what you have problems with, and they'll book you right in right now. There's also stories about boats of people outside of like on the border of Mexico just to get like ibogaine appointments, like people that have PTSD or just seen in boats waiting for their clinic appointment.
Well, where are people? This is the first I've heard of it, and reading your information in the Texas Tribune, Stephen. But where are people getting this information? Is there like an underground helpline for people with PTSD and brain trauma?
So pretty much what I've heard is it's almost like an urban rumor amongst the military community. And
Ah,
so it's gotten passed around these like special ops people. And so once they go in for like PTSD and training, someone will be like, hey, I heard ibogaine can like help you here. You might want to check it out in Mexico. And then what happened is that Stanford University noticed that veterans that were going to Mexico weren't coming back for their VA pills anymore. And so that's sort of what gauged the interest. Like, what's going on in Mexico that's causing people no longer to need opioids?
well, people were taking diabetic medicine, Ozempic, and there was a side effect, and now everybody's like, well, let's see what that's about. So I get it.
Do you think that this could be revolutionary in the space of treating post-traumatic stress?
People are saying, Stanford University says if the ability of this drug is actually what they're predicting, this would be one of the biggest medical breakthroughs since the polio vaccine.
Wow.
Because it's just something that we have never seen before, which is regenerate brain tissue, which means that could like lead to cures in dementia, that could help in PTSD, withdrawals. Like it's so many different things that could be done with just regenerating brain tissue.
Well, so I was wrong. It really could help brain trauma. I mean, physically help it.
Yes,
Wow.
yes. And so that's what they're really looking into is like they're seeing signs of severe brain trauma. And then once they take this, it almost removes up to 5 to 10 years worth of damage.
Wow.
Wow.
Well, this is so interesting, Stephen. Thank you for being here today to share
Thank you,
this.
guys.
All right, Stephen Simpson is the mental health reporter for the Texas Tribune. So, welcome to Hello Houston. We're glad you joined us.
Thank you.